Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome and thank you for joining our weekly podcast, Redefining Medicine. We are pleased to welcome Dr. Tara Scott back to the podcast. Dr. Scott is an integrative gynecologist with over 25 years of experience, medical director of Summa Health, and founder and chief medical officer of the Revitalize Medical Group. Welcome, Dr. Scott.
Thank you, Lindsay. It's great to be here.
Dr. Scott, can you tell us a little bit more about your practice?
Yes, my practice, Revitalize, is located in Akron, Ohio. I do have a medical license as well in Montana and Florida. Those are virtual practices. And we have a team approach. We're a small practice, so we get to know our patients. Our staff is the same staff that you're going to see. I have a naturopathic doctor who's working with me and learning the ropes of hormones, and her kind of wheelhouse is fasting and keto, and along with metabolic health and women's hormones. My obviously wheelhouse is going to be anything hormonal for women, specifically endometriosis, PCOS, prevention of breast cancer, and even I see a lot of breast cancer patients after their breast cancer treatment to try to navigate decreasing recurrence. And I just also recently hired another MD who just got her IFM certification and is also learning the ropes and interested in niching down into women's health. So we have a small practice, a great cohesive team. We have a health coach who works alongside of us, who is great for, both in, physical activity as well as dietary moderation for food allergies and intolerances, and really is just an accountability coach for our patients that are trying to get their metabolism back on track as well.
Dr. Scott, you've previously shared your journey to integrative medicine on the podcast and discussed your passion for treating endometriosis, hormones, and breast cancer. Are there any recent clinical research or clinical updates that surround these topics you would like to share?
So I don't have any clinical research, but I'm digging deeper into the genomics connection between estrogen detoxification and breast cancer. I was recently able to present at A4M about that exact topic, and also entered a poster at the annual meeting of the Institute of Functional Medicine, and where we won peer vote of best poster. So that's exciting.
Can you share with us the topic of your poster?
So my poster was about an integrative approach to breast cancer, and the first part of the poster walks you through estrogen detoxification as a review for clinicians, and the second part is a case review of breast cancer patients who have had problems with their estrogen detoxification from a genetic single nucleotide polymorphisms, or a SNP. And so the third part is a literature review of all the genetic alterations that have a correlation with an increased incidence of breast cancer. So I'm trying to really set the stage that if we identify these genetic SNPs or these clinical conditions that reflect high estrogen, these are the people that we should be more proactive about prevention of breast cancer. So it was mostly a case presentation along with a literature search about methylation and other genetic SNPs. But it was more clinically applicable. So if you're a provider who are seeing these patients, it'll raise your antenna for a different type of care and deep dive into their hormone issues.
Dr. Scott, you will be speaking at the upcoming A4M event centered around women's hormones, scheduled to take place this summer. Will you share a little bit about what you intend to speak on and why this topic is so important for clinicians to further study?
So for this particular upcoming conference, I'm talking about the science and the sense of hormone therapy. And so this is something I'm actually really excited about speaking about because I'm a traditionally trained doctor, OBGYN. And so when I started my journey in my studying of integrative and functional medicine through A4M, I wanted to know the evidence. I wanted to make sure that what I was doing was evidence-based medicine, because at the time that I started 15 years ago, it was it was heavily scrutinized by my traditional counterparts. And I was in a practice, a large practice where a lot of them really essentially grilled me about what I was doing. There's so much more evidence nowadays that we have available, many more studies that have been published, more available to us. So I was able to compile, since the WHI, which is the hallmark study, like the last almost 20 years of data. So we could objectively look as what are the risk benefits, what is the science behind what we're doing. So many practitioners reach out to me and they're very confused about what should they do, and what are the traditional organizations like North American Menopause Society recommending. So I'm really happy that I'm able to kind of just lay it all out, talk about the physiology of the hormones, and give you science and evidence-based journals and studies that back up what we're teaching. And I think that's really important for people who are concerned about kind of deviating from what's traditionally acceptable.
Are there any particular gaps in education and other roadblocks surrounding women's health that you see among clinicians, even among those who may already be aware of integrative medicine?
Yes, I will tell you, like I said, I was very traditionally trained as an OBGYN. And even after the 5 years of residency that I did, I graduated with very little knowledge about hormones. I mean, we learned how to operate. We could cut a baby out in a minute in an emergency C-section, right? But we didn't know very much at all about office gynecology, and certainly not the management of menopause. And even expanding that to endometriosis outside of a surgical therapy. We didn't learn medical management. We didn't learn about polycystic ovarian syndrome from an option of how to manage them. What we're taught traditionally is the patient presents with certain symptoms. Let's make sure they don't have cancer or a mass. And in the absence of that, let's treat the symptoms. So all these patients are usually offered our birth control pills, which may help the symptoms, but don't treat the cause. And so with root cause analysis and the approach of functional and integrative medicine, what we really want to do is we want to treat the cause. So there's that huge gap. If you're a traditionally trained, and to be an OBGYN, you have to go through traditional training. So there's just a huge gap in what we learn. And so in order to be able to do this type of medicine, education, training, further training, like I did through A4M, is really, really necessary to be able to navigate the landscape of prescribing hormones and treating these hormonal conditions.
Dr. Scott, as a clinician, medical director, chief medical officer, and more, you manage a lot of high volume moving pieces. How have you prioritized your own health, mental and emotional wellness recently?
So that's a tough one, right? So mom of three, busy mom, and I'm the overachiever mom who has to be on the board of the show choir and be the room mom and do all these extra things to make sure I was present for my kids. So it's been quite a juggle. And for me, I'm really fortunate that I love to exercise. So as far as physical health, that's running is my Prozac, and so it keeps me sane, and that connection also with friends. So, but it's just something that you have to schedule on your calendar as if you would schedule your patients. And so work-life balance is continuing to be challenging for me personally, but especially through navigating hard times, you more and more realize that your self-care has to be a priority. So it's something I'm still working on. I might be really good on the physical health, and of course getting my job done, but the self-care probably needs a little bit more work.
Thank you. And final question, Dr. Scott, what advice or words of encouragement might you offer clinicians who are struggling to personally navigate through this time?
So during this time, there's been a lot of toll on practitioners and certainly on practice and certainly small business owners with everything that's gone on with COVID. And so I think there are a lot more resources on the business side from organizations such as A4M and other groups like Facebook groups and courses that can help you navigate these. And I do think as a practice owner, you need to kind of be aware of, what the options are to keep your practice afloat. I think self-care is increasingly important as well, because these unprecedented times where you may not have had stress, maybe you did have a lot of stress before COVID, but now everybody is stressed. Your patients are stressed, your your coworkers are stressed, you're stressed. So I think it's a good attention that we are, especially in something like integrative medicine, that the focus is on the whole self, is not just physical, it's mental, emotional, spiritual. So I think having that kind of training for us is really coming in handy at a time like this.
Well, thank you so much for sharing your insight with us today, Dr. Scott. We truly appreciate you and your time.
You're welcome.
And we'd like to thank all of our listeners and welcome you back next week to Redefining Medicine.